Heart failure, a multifaceted condition, casts a wide net of complexity over the realm of cardiovascular health. In this comprehensive guide, we embark on a journey to unravel the intricacies of heart failure, distinguishing between its left-sided and right-sided manifestations. Our goal? To provide clarity on the underlying mechanisms, recognize the subtle differences in symptoms, and outline effective diagnostic approaches. By delving into the intricate interplay between the cardiovascular and pulmonary systems, we empower you to navigate the labyrinth of heart failure with confidence. Armed with this understanding, you'll be better equipped to provide optimal care for patients grappling with this challenging condition. In the realm of left-sided heart failure, the repercussions reverberate throughout the body, leaving an indelible mark on both the cardiovascular and pulmonary systems. Patients grappling with left-sided heart failure often find themselves in the throes of systemic distress. Edema creeps into their extremities, dyspnea becomes a constant companion, and the weight of fluid overload presses down upon their chests, exacerbating with every breath. Paroxysmal nocturnal dyspnea, PND, haunts their nights, disrupting the sanctuary of sleep. But the story doesn't end there. A closer examination reveals telltale signs of the heart's struggle. Rails and crackles echo through the auscultatory landscape. A S3 gallop sets the rhythm of distress, and pitting edema marks the battleground of fluid imbalance, a physical manifestation of the underlying pulmonary congestion. At the heart of it all lies the left ventricle, grappling with its own demons. Impaired by myocardial infarction, besieged by hypertension, or ensnared by valvular heart disease, the left ventricle falters in its mission to propel blood forward, setting the stage for the cascade of events that define left-sided heart failure. In the symphony of systemic implications, left-sided heart failure emerges as a poignant reminder of the interconnectedness of the body's systems and the profound impact of cardiovascular dysfunction on overall health. In right-sided heart failure, congestion spreads throughout the body, causing increased vascular resistance and venous overload. This condition often starts with a rise in pulmonary vascular resistance, disrupting the balance of pulmonary circulation. Lung diseases and left-sided heart failure contribute to pulmonary hypertension, which further exacerbates the problem. As pressure builds in the pulmonary vasculature, the right ventricle struggles to cope. It enlarges and stretches, leading to hypertrophy and dilatation. These changes indicate the heart's increasing difficulty in managing the increased load. The effects extend beyond the heart. Edema causes swelling in the extremities, especially the ankles. Jugular veins distend due to high venous pressure, and the liver enlarges, hepatomegaly, as it struggles to process the increased flow of deoxygenated blood. Right-sided heart failure results in widespread congestion, highlighting the significant impact of cardiovascular dysfunction on the body. In heart failure, distinguishing between left and right-sided types is crucial, requiring keen observation and understanding of their differences. In left-sided heart failure, edema appears in the extremities, signaling pulmonary congestion. In right-sided heart failure, edema is primarily in the ankles, indicating venous overload. Each type of heart failure has distinct symptoms. Left-sided heart failure is marked by dyspnea, orthopnea, and paroxysmal nocturnal dyspnea, all pointing to pulmonary congestion. Right-sided heart failure also has respiratory symptoms but reflects systemic venous congestion. Jugular venous distension is a key sign of right-sided heart failure, indicating venous backup. Hepatomegaly is another significant symptom, as the liver struggles with the increased flow of deoxygenated blood. Each type of heart failure has its own symptoms and pathophysiological characteristics. Distinguishing between them is essential for understanding and managing cardiovascular dysfunction. In the battle against heart failure, prevention emerges as a formidable ally, a beacon of hope in the face of adversity. Implementing lifestyle changes stands at the forefront of this crusade, addressing comorbid conditions, bidding farewell to substance abuse, and embracing the pillars of a healthy diet and exercise regimen lay the groundwork for fortification against the encroaching shadows of heart failure. But the quest doesn't end there. In the labyrinth of prevention, identifying and tackling reversible causes takes center stage. Thyrotoxicosis, hypertension, anemia, each presents a battleground, a chance to turn the tide and rewrite the narrative of cardiovascular health. Medication becomes our weapon of choice, a shield against the onslaught of heart failure. ACE inhibitors, ARBs, beta blockers, diuretics, each plays a crucial role in regulating fluid balance, bolstering cardiac function, and fortifying the heart's defenses against impending doom. Yet vigilance remains our greatest asset. Regular monitoring, steadfast follow-up, these serve as our watchmen, standing guard against the insidious whispers of heart failure, ensuring early detection and swift intervention. In the realm of prevention, each action, each choice, becomes a step towards a future untainted by the shadows of heart failure. Together we stand, united in our quest for a world where heart failure is but a distant memory, a testament to the power of prevention. In the battle against heart failure, a comprehensive treatment approach is essential. Key medications include ACE inhibitors or ARBs, beta blockers, diuretics, and spironolactone, forming the cornerstone of our regimen. For those with impaired contractility or ejection fraction, positive inotropic agents like dobutamine and digoxin are added to improve heart function. In acute crises, such as decompensation and pulmonary edema, supportive measures are crucial. Oxygen therapy, morphine, and nitrates provide relief and stabilization. For patients with atrial fibrillation, medications for rate control, including digoxin, help restore a regular heart rhythm. Each treatment choice and intervention is a critical step towards managing heart failure and improving patient outcomes. In cardiology, hypertrophic obstructive cardiomyopathy, HOCM, presents a unique challenge. Diagnostic techniques are crucial. The hand grip maneuver helps confirm the presence of the murmur, while the Valsalva maneuver and standing can exacerbate murmurs, revealing underlying issues. Diagnosis is only the beginning. Treatment is the next step. Beta blockers help reduce the obstruction and diuretics ease the heart's burden. In managing HOCM, each diagnostic and treatment step is important. With knowledge and care, we work to overcome the challenges of this condition. Sudden cardiac death is a serious concern in cardiac health, highlighting the unpredictability of life. For young athletes, hypertrophic obstructive cardiomyopathy, HOCM, is a hidden risk that can strike suddenly during intense physical activity, cutting short promising futures. Older adults face risks too. Aortic stenosis can cause angina, shortness of breath, and syncope, signaling severe heart problems. Despite these risks, early detection offers hope. Regular screening and vigilant monitoring can help prevent sudden cardiac death. In combating sudden cardiac death, knowledge and compassion are essential. Through prevention and awareness, we work to reduce the impact of this condition, demonstrating the resilience of the human spirit. Aortic stenosis is a serious heart condition that can lead to mortality. Its symptoms, angina, shortness of breath, and syncope, signal impending danger. Diagnosis is essential. Auscultation helps detect murmurs indicating valve obstruction, while echocardiography assesses the severity. The condition is particularly dangerous because it can progress silently, often without symptoms. If left untreated, it can severely damage the heart. Early detection and treatment, such as valve replacement, are crucial. This surgery can restore normal heart function and prevent sudden cardiac death. In fighting aortic stenosis, knowledge and compassion are vital. Managing heart failure presents numerous challenges that require a tailored approach for each patient. Understanding the complexities of heart failure is key to effective treatment. A multidisciplinary team, including cardiologists, primary care providers, nurses, and allied health professionals, works together to provide comprehensive care. This collaborative effort strengthens our ability to manage heart failure. The journey doesn't end with diagnosis and treatment. Continuous monitoring and vigilant care are essential as we adapt our strategies to meet patients' evolving needs. Despite the uncertainties, our commitment to overcoming heart failure remains strong. Guided by knowledge and compassion, we strive to improve outcomes and restore hope for our patients. We are entering a new era in heart failure care, marked by innovation and progress. The future offers promising advancements in technology and treatment. Technology is a key ally, with wearable devices and remote monitoring systems providing real-time data and insights. These tools help us intervene more precisely and effectively. Data analysis, especially through machine learning algorithms, helps us understand heart failure better and develop personalized care plans. Looking ahead, regenerative therapies and advanced implantable devices offer new hope. These innovations bring us closer to the goal of not just managing, but potentially reversing heart failure. As we move forward, we must embrace new ideas and technologies. Together, we can work towards a future where heart failure is a thing of the past